Welcome to an introduction on how to transfer, adapt, and implement health and care solutions across systems. Across Europe, health and care systems face aging populations, more chronic diseases, and tighter budgets. To meet these challenges, organizations can save time and resources by adapting proven solutions from elsewhere, avoiding repeated mistakes and accelerating progress. But each system is unique, so careful adaptation is essential. This video explains the key principles and tasks for successful transfer and implementation. Transfer and implementation is an iterative process, not linear. We see solutions as practices shaped by people, tools, and environments. Evidence is relational. Success depends on how a solution interacts with its context. And evaluation is theory-based. A theory of change explains why and how the solution works, and your theory of change evolves as you test and learn. The THCS framework sets out a number of guiding principles that should shape every transfer and implementation effort. Start with demand-based development. Your activities should be driven by real needs in your system. Then, ensure person-centered development, where the needs and goals of patients, clients, and citizens are at the center of the process. Co-creation is essential. Bring together professionals, managers, policymakers, clients, and researchers. Each has a unique perspective, and involving them early makes solutions more relevant and sustainable. Through this, you enable mutual learning, where everyone learns from each other across systems and organizations. Be open and transparent in sharing knowledge and evidence to build trust and accelerate adoption. Stay agile so you can adjust quickly to new challenges or findings. And finally, focus on evidence generation. By learning while implementing, you create knowledge that helps refine and improve solutions over time. The THCS framework highlights the key tasks you need to perform when transferring and implementing solutions. Importantly, this process is iterative. You move back and forth between tasks until sustainable change is achieved. The tasks are grouped into three interconnected sets of tasks: aligning and organizing development activity, adapting a solution developed elsewhere, implementing the adapted solution, and to explore how to describe health and care solutions and their adaptations, watch the video Introduction to Describing Health and Care Solutions in the THCS Knowledge Hub. When starting the process, the key task is to align and organize your development activity. Begin by identifying the needs for change. These might come, for example, from poor outcomes, rising costs, or gaps in access to services. Then, translate these needs into shared goals and clear metrics that can guide the process and help you measure success. Once you know what you want to achieve, search for existing solutions that are already evidence-informed. It's likely that someone else has faced a similar challenge before. By looking for solutions in databases, reviews, or the THCS Knowledge Hub, you can save time and benefit from others' experience. But before you move forward, perform a transferability analysis. This helps you assess whether the solution you found can realistically be applied in your own system, and whether similar outcomes can be achieved as in the original development environment. Once you've identified a promising solution, the next step is adapting it to your own setting. Start with a feasibility analysis to check whether the solution is practical and viable in your context. This includes looking at resources, staff, workflows, and culture. Then, move on to adapting and localizing the solution. This may involve changing the solution itself, but often it also means changing your organization or environment to make the solution work. Next comes testing and evaluating. Test the adapted solution, collect data, and see how well it works in your context. Use short testing cycles if possible, so you can adjust quickly. Finally, refine the theory of change. Update your understanding of why and how the solution works, based on the new evidence you've generated. This cycle of testing and refining continues until the solution is stable and ready for wider use. Once the solution has been adapted and tested, it's time for implementation. Start early to prepare a detailed implementation plan that sets out resources, responsibilities, and timelines. Build an implementation team that includes the right stakeholders for your solution. Then, implement the solution in practice. Provide training, support, and communication so that the staff and stakeholders are confident and engaged. Ensure that the core elements, interactions, and features of the solution and its context are enacted. At the same time, evaluate the process and outcomes. Use the metrics you defined earlier to monitor progress. Look at both short-term outcomes, such as improved access or satisfaction, and, within a suitable time frame, long-term outcomes, like better health or reduced costs. Finally, focus on sustainability. Implementation doesn't end when the solution is in place. Health and care systems evolve, so solutions must be maintained, updated, and improved over time to stay effective and relevant. Thank you for watching this video on transferring, adapting, and implementing health and care solutions. We hope it helps you apply evidence-informed solutions across systems to achieve meaningful and sustainable improvements. For more details, you can also explore our online handbook in the Knowledge Hub on transfer and implementation. THCS. Each of us can make a difference. Together, we make change.